strapline is economics, health, and tobacco harm reduction. How do you think these three elements interact?
It's interesting, we don't often talk about the economics of harm reduction, but it's been fascinating to really look at the cost savings that investing in harm reduction achieves. And when you think of a country like Australia where 20,000 people die early because of smoking, then you can see the cost savings and the productivity numbers going up. So I think it's a very important conversation to have. I think policymakers are always interested in the dollar. So if we can present arguments around financial arguments, then I think that actually assists us with harm reduction rather than just we're saving people's lives, we're saving money for governments.
Well, it's huge. As we were discussing in our panels, that globally the market for consumer nicotine products is somewhere in the range of $1 trillion a year. It is absolutely enormous, way over 1 billion consumers. There's huge economic opportunities for people to replace the deadly products with consumer acceptable, far lower risk products. That's enormous in terms of the impact that has on health, the impact that health ends up having on our economies. It's a tremendous opportunity for businesses to do good. This is similar to what we saw with the transition to far safer products and services in so many other areas, where we talk about sanitary food or science-based medicine or safer automobiles, safer railroads. I mean, we've seen this happen on so many other areas, and this one is on the verge of a major transition. We're already seeing it happening, and economics are going to be pushing that an awful lot, along with consumers. Consumers are deciding what they want. Regulators are learning that you can't dictate what consumers do. You can facilitate it, you can empower them, but you can't just deny them access to safer products.
It's one of these situations where harm reduction so obviously is beneficial from a broader societal economic perspective and a health perspective. I mean, the evidence is conclusive. You have the top journals, New England Journal of Medicine, Lancet, JAMA, Cochrane Review, National Academy of Science, the United States, all making clear that harm reduction is the beneficial approach with tobacco as with other drugs from a health perspective. I think economically, the benefit of a society, not having to deal with smoking-related illness to the same extent is monumental. I think the only downside is that there's a vast tobacco industry. And so you look in countries around the world, whether it's China or Malawi or Zimbabwe, this will do harm to tobacco farmers. They will lose out, and that's part of the sad change that will be necessary as we move in a more productive direction. But basically, for the broader society, it is a massive positive economic impact as well.